Hi friends, welcome. In this video, let us learn the anatomical basis of varicocele. Varicocele is a clinical condition in which the pampiniform plexus veins of the testis become dilated, tortuous and elongated. Just look at this picture. You are seeing the pampiniform plexus veins. So here the veins are dilated. Okay, so here is the surface view of this varicocele, and this condition is known as the varicocele. So what is varicocele? I told you it is the dilated, tortuous, elongated, pampiniform plexus of veins. So let us learn what are the anatomical basis of this condition and which testis is mostly affected by this. Commonly, this condition affects the left testis. Okay, let us see what are the reasons for this condition. Just look at this diagram. In this diagram, you can see here is the testicular vein, right testicular vein, and here we have the left testicular vein. Remember, the right testicular vein drains into the inferior vena cava, whereas the left one drains into the renal vein. This left testicular vein opens into the left renal vein at right angles, whereas the right one opens into this inferior vena cava at an acute angle. As this left one opens into this left renal vein at right angles, the venous pressure is high in this left testicular vein. The first point is this one. The first point is what you have to write in examination. The first point is left testicular vein opens into the left renal vein at right angle. So the venous pressure is high on the left testicular vein. Okay, that is the first point. And the second reason is the valves in this left testicular vein is less competent. See, we have the valves in this testicular vein, but the valves in this left testicular vein is less competent. Next, just look at this picture. You can see, can you identify the structure? This structure, what you are seeing is the superior mesenteric artery, SMA. Superior mesenteric artery is a branch of abdominal aorta. Okay, and can you see the structure here? This one, this is the left renal vein. Okay, left renal vein. You can see that superior mesenteric artery arches over the left renal vein. Okay, just I am drawing line here. Just see. So here, this is the abdominal aorta. So this is the superior mesenteric artery, and here we have this renal vein. Okay, so this particular relation, okay, that is the superior mesenteric artery and the abdominal aorta makes an angle over there. That is known as a aortomesenteric angle. Okay, aortomesenteric angle. Sometimes what happens actually, the superior mesenteric artery may compress the left renal vein. Then what happens? If the superior mesenteric artery compresses the left renal vein, this left testicular vein, opens into this or drains into the left renal vein. So because of this compression, there may be less venous return into the inferior vena cava. That also might be a reason for the increased chances of varicocele on the left side testis. That is the next point what you have to write is compression of the renal vein, left renal vein by the superior mesenteric artery. Okay, just look at this picture. So here we have the superior mesenteric artery, this is the abdominal aorta, here is the left renal vein. So here just look at the second diagram, you can see this renal vein, this is the left renal vein, superior mesenteric artery. So here the superior mesenteric artery is compressing the left renal vein. See, this is the testicular vein. See the testicular vein, there is the tortuosity in the testicular vein. That was I was telling, the compression of the left renal vein by the superior mesenteric artery also a reason for the increased chances of this varicocele in the left testicular vein or the left sided testis. Next reason is the loaded colon, loaded sigmoid colon may compress left testicular vein. Okay, compression of the left testicular vein by the loaded sigmoid colon also leads to impaired venous return from the testis. That also can be a reason for the increased chances of varicocele on the left side of the testis. Now let us see the next reason. Okay, just look at this area. So here we have the left, we are seeing the kidneys on the other side, we have the left renal vein, you can see here, this is a left gonadal vein, left gonadal vein. Just opposite, did you see the left suprarenal vein? That means the just opposite to the opening of the left gonadal vein, there is the opening of left suprarenal vein, left suprarenal vein. You know, suprarenal vein is draining from the, so here we have the suprarenal gland, so here we have the suprarenal vein. Okay, so the suprarenal vein carries hormone rich blood, that is adrenaline rich blood. Adrenaline from the suprarenal gland is carried by the left suprarenal vein that opens into this particular left renal vein. Okay, so when the blood from through this left suprarenal vein opens here, so the adrenaline present in this blood may causes the vasoconstriction of left renal vein. Adrenaline rich blood in the suprarenal vein may cause, what will happen? Vasoconstriction in the left testicular vein, And another reason is, if there is a tumor in this left kidney, okay, left renal tumor in the left kidney may compress the left renal vein. Okay, and the last reason is left testicular vein is longer than the right one. Okay, so these are the anatomical reasons why the varicocele is more on the left side testis. Okay, hope you understood the. If you like the video, please like, share with your friends. Thank you.